Oh, hey, my name's Scott Goldberg. I'm a doctor, I'm a general internist, and I provide primary care to adults in the South Bronx here in New York City. And I am a advocate for Medicare for All and Bernie Sanders. So I've been working on Medicare for All for about the last 10 years. And I have seen since I started medical school that we have a healthcare system that is profoundly dysfunctional, unequal, unfair, and expensive for so many people in this country. I think that we all know the facts that 40,000 people die every year from not having insurance, that the largest cause of bankruptcies in this country are due to medical bills, and that despite spending so much on healthcare in this country, we have worse outcomes than other industrialized countries with national health insurance systems. And the fundamental problem to me is that we have a system that is based around profit making. That there are insurance companies that are publicly traded, pharmaceutical companies, and hospital systems that make profit off of the delivery of care. And as a physician, I feel that healthcare is something that should not be treated as a commodity, but treated as a human right and a public good, like education, like police services, like fire services. So every day now in my practice as a primary care doctor, I see the effects that our current system has on my patients' health and well-being. I spend hours each day finding out that medications I prescribed for patients were denied because of the insurance companies. I find out that my patients have high deductibles and co-pays and costs for pharmaceuticals, and have to make cruel decisions about whether to pay for the electricity or pay for their medically necessary drugs. And I've seen people truly suffer from a system that doesn't have to be the way that it is. So I know that a Medicare for All system would do many things for my patients. It would create a system that says that everyone deserves access to healthcare, and the same access to healthcare regardless of whether they're rich or poor, regardless of the color of their skin, where they live and where they grew up, and what job they have. It would create a system in which people could get the care that they need in a timely fashion, and it would create a system in which I would be able to provide the care that I've been taught to provide for my patients without having to deal with a sort of middleman, a private insurance company, whose only interest is making money for their companies, their executives, and their shareholders. A Medicare for All system would restore medicine to the way in which it was meant to be practiced, which was between a physician and their patient. And I think in some ways Medicare for All will not only provide better care, save our country money, it will protect the sanctity of the doctor-patient relationship. Because of this, I'm supporting Bernie Sanders for President of the United States. I supported Senator Sanders since he ran for the nomination in 2016. Senator Sanders has been working on Medicare for All and fighting for this for his entire political career. And in his words, he wrote the damn bill. And I trust Senator Sanders more than any of the other candidates to fight for the system that is best for poor and working class people, and that doesn't just benefit people who have the means to afford better care. So in my mind, Senator Sanders is building a movement, a nationwide, multiracial, broad-based coalition for Medicare for All of physicians, nurses, working class people, patients, and that's the only way we're going to get Medicare for All in this country. We can't rely on the politicians to pass this. We need a broad-based, nationwide movement of millions of people coming together to say enough is enough. We need to guarantee health care for all Americans. So that's why I'm supporting Senator Sanders, and that's why I'm confident that if he's elected, we will finally get Medicare for all. Thank you.